vaccine campaign, what's the quantity? How intensive are you really doing this awareness?
So besides the campaign that is ongoing now, Breakthrough Action is having jingles on um, about 53 radio stations across the country, airing messages on prevention and control measures on Lassa fever, rabies, and other zoonotic diseases that are part of our thematic areas. So it's widespread. We are across 12 counties that we do awareness both locally at community level and using radio stations, community radio stations, and other platforms to create awareness on zoonotic diseases.
Now, one who want to ask, Mr. Khan, why the breakthrough action is not concerned about, you know, putting your resources into human health rather than, animal health?
So for you to have better human health outcomes, you must start dealing with animal health because, like Eddie said, out of every three human diseases originate from animals. So if we only targeting human health, it will just be like we just going for treatment. But for us to attain maximum prevention and control, we must start targeting it because if we have healthy animals and we have healthy environment, we will have healthy people.
Okay.
So it starts from that point.
Now, your whole focus, your concentration is to pump some resources into the awareness. What is the message that you've carved as part of the campaign, as part of what you want to tell people to know? What is containing your awareness message?
So for the vaccination campaign, we want to let the public to know that there's a vaccination campaign ongoing across the counties that they should come up with their animals. Dog for rabies vaccination, sheep and goat for the PPR vaccination. So that in the various counties there are people moving around in the communities that are vaccinators, and once you have your dog, once your dog is 3 months and above, your dog is qualified to receive the vaccination.
You poured mass and all to it?
Yeah.
I thought you got a small baby dog. You can also vaccinate a dog.
3 months and above.
3 months. Okay, we'll come back to that as to why you thought that was necessary. Let's hear from you, Mr. Fangalo. How is the vaccination exercise is being carried out? I know you got your people in the field, but how are they doing it?
Okay, thank you. So as Rachel said, we selected 6 counties out of 15 because of resource constraint. And as you say, why is Breakthrough Action supporting animal
Then human health.
and that has been the argument. Because even if you go to somebody to tell them that, oh, we want to vaccinate animals, say, but humans are not getting food. Why would you want to vaccinate animals? But that needs to be changed. So currently we are into 6 counties. We have Nima, Lofa, Bon, Bapolo, Kima, and then Moserado.
Okay.
So we have a team of vaccinators and also awareness team as well. That's good, but it's not easy when it comes to convincing people. So currently we vaccinated over 3,000 dogs, assistants, and then over 6,000 golden sheep.
Okay.
So it's a 10 days vaccination campaign, and then 3 days for awareness. So the same thing is going around and doing that. And we were blessed to have gotten 30,000 doses of rabies vaccine from the World Organization of Animal Health. That's the OIE. That's the WHO for agriculture. And also we got over 300,000 doses of PPR vaccine from FAO as well. So as it's still going on. We are vaccinating across the 6 counties. That's the first phase. And then when we get some resources, we're going to go to the other counties.
Okay.
As well.
You said 6 counties. How many counties? You said 6. What are those counties, brother?
So that's a Bon County, Nima, Lofa, Kemang, Bapon, and Moserado counties.
Okay, now, so you have your people in the field. Are they going from house to house, or are they stationed somewhere and the people are trooping there with their dogs and animals?
Yes, so
Sheep and and
Yes,
goats and all of
yes. So meaning what we do is meaning about door to door.
Mm.
But for most rather we had Dupro clinic that people already aware, so people move with their dogs. And we also have mobile clinics. As I said, it sounds somehow when you're talking vaccinating animals. So we are going extra mile to move from door to door.
Mm.
Because the plan from the One Health reducing project is that we want to have a routine site, like the way human beings take babies or kids to hospital every day to be able to be vaccinated. But also we are lacking when it comes to funding. And so once we get the funding, we're going to have a routine site where Monday to Friday or Saturday you can take your dog there and then have it vaccinated.
Now, you say it's a difficult thing convincing our people. Let's assume your vaccine team went to the house of Mr. Sober George and I got two dogs there. How do you convince me so that I can make my dogs available?
Thank you. So the first thing is about your knowledge on why your dog should be vaccinated. That's the first thing.
You're going to
Uh,
provide me that knowledge.
Yes,
Okay.
so we have some tips to let you know that even though you have the dog here, the dog, normally people don't really raise dog in the face or don't put them on chin.
Mm.
We allow dogs to go and find food for themselves. Even if we go to the garbage, you see dogs. But
Okay.
I ask this question whether we have dogs that don't have owner. It's not true. Now, even at the garbage, when you get there at midnight, you won't see any dog there. They have gone to their houses.
Mhm.
So they leave dog to go and find food for themselves because we are not feeding them. And then when they come across another dog, they fight. And once they fight, the dog that was okay from the house coming to you now is coming, maybe being infected, affected with the virus. So you start seeing changing behavior. Want your own dog, once you call it, they will start biting at you. So that's a caution that you should stay away from that dog.
Mm.
And then it also, another thing you want to do to the dog is like grinding. So you have to stay away. So what we tell people is that try to quarantine the dog for 14 days.
Quarantine dogs as well?
Yes, you have to quarantine the dog because you don't want the dog to transfer that disease to so that's why it's good to know your animals because you should know when the behavior changes and what attitude you know about the dog or your animal, even sheep and goat. So once you know that, you see you have to quarantine the dog for or call MOA will have to quarantine the dog for 14 days.
Why do you take the dog to quarantine the dog?
So we have the Center Veterinary Laboratory. So we have a lab in this country that do testing for all animal samples. It's located as Fenner. So we normally take the animals samples there, test it, and then we'll get to know whether it is positive. We let you know that okay, this dog is positive, and this the person that was beating needs to be given the post-exposure prophylaxis. But let me just note that even as that, the tradition of eating dogs is something that is becoming common. But we try to convince people that try to vaccinate your dog because what affect the animal also affect it. You know how much Ebola cost the whole world. Even Liberia, the millions of dollars that were spent because it wasn't prevented from the source.
Okay.
So even if you have the best hospital and you have the source of the disease home, for example, let's say malaria, right? And then you get sick and go and get treatment, whether Ghana or the US and come back. That source is still there. You still get infected. So the environment is key. That's what the One Health is there for. The environment is key. You have to have a clean environment. You also have to have a better animal to be able to have a good human health. So those are the three interfaces we're looking at on the One Health platform that has been the coordinating body on this. So Regisi is also supporting that aspect. FAO from the animal health side is also doing that. And also Breakthrough Action being the arm of the risk communication pillar under the One Health platform also came in and saw the need that's a need of behavioral change. Because they carry all the awareness out there, developing the trying to come up with the demand on why people should do it. But we as government need to also give the supply to the population. Because if we say when you are beating, take your dog to take the person to the hospital for treatment, then the person gets there is no vaccination, the person becomes reluctant. So next time when it happens, the person will say, oh, I went there I worked there for 3 hours and couldn't get the vaccine I wanted, so no need to go there. So the picture of rabies is once you are baiting, it depends the distance from the central nervous system, that is the brain. Because rabies affect the brain. So at times when you are baiting, someone says that's just a scratch. There's nothing but scratch in rabies case. Because even a scratch can lead to something else. So it's good to seek treatment
when you're bitten by the
when
dog.
you get bitten by the dog. Because for us, when we vaccinate the dog, we give certificate, and it goes for 1 year. Because every year the dog needs to be vaccinated. So once the person is bitten, the person shows the proof of vaccination and it's valid. I think the risks of that disease going further is limited. So that's why we encourage people. And another economic aspect to that is a dose of rabies vaccine costs about $40 to $50,
Mm.
and person need to
United States dollars.
United States dollars, and the person needs to take about 5 of them. So if your dog, if someone was bitten by your dog, or let's say 5 person were bitten by your dog, just do the math. 5 times 5. You know how huge that amount
So,
is.
are you saying, Fangalo, that if a dog is vaccinated, the issue of transferring the rabies to human, it's minimized?
Yes, it's minimal. As of no prevention, the best way for prevention is vaccination. So once the dog is vaccinated, even for the dog itself, if the dog comes into contact with another dog that is rabid, there is also a limited chance of it coming down with that. And also if the dog bites somebody, there's also another limited chance of the person getting that.
Okay, we'll come back to you, Fangalo, from the Ministry of Agriculture, as to the strategy in making sure that you can cover all of the dogs in those 6 counties that you're currently piloting. Let's hear from Breakthrough Action. You are basically concerned about the awareness aspect. Are you also going from doors to doors with your flyers, with your loudspeaker to educate our people?
Yes, so Breakthrough Action supports the risk communication and community engagement arm of the One Health platform.
Okay.
So that platform is at the national level and also at the county level.
Mm.
Equally so, we work with the county health teams across our intervention counties,
Okay.
12 counties, and we have posters and banners and also the audio messages that are aired on radio stations. But we have these posters posted in high traffic areas, population traffic areas like schools, marketplaces, and yes, in some communities they go door to door, like in River G, that I know of, the guys there go door to door in the community because they have had a lot of cases of animal bite and dog bite. So they took also time to engage those communities that are reporting those high cases and moving from door to door, doing the awareness on the rabies and the danger of rabies for dog bite. Also, we have our field managers in the counties that are working along with the health promotion team at the county level, and they go to hospital facilities and doing health talk. They provide the awareness to the population. Yes.
Now, can you give us a figure? How much have you pumped into this whole animal dog vaccination, animal vaccination? How much have you pumped into that?
Well, it's a lot of money that I can't see offhand right now because the Breakthrough Action project is into its 3rd year. Like I said, it's a social behavior change project. We create the awareness, we create the demand, we provide the information for people to improve health behaviors, changing from one bad health behavior to an improved one so that we can have better health outcomes across the country.
I know when the Ministry of Health approached the Breakthrough Action, so look, this is a project I want to undertake. We're hoping that Breakthrough Action can come and help us with the aspect of our whole project. I'm sure you were able to do your own analysis and your own survey comprehensively to determine whether what the Ministry of Agriculture wanted you to get into was necessary and it's something that you should pump your money into to get some sort of positive response from that. What did your analysis say to you about the spread, about the current, the constant occurrence and the rapid spread of this whole thing called rabies?
So our project is not narrow to rabies only.
Okay.
Yes, so we create awareness on a lot of zoonotic diseases, right? Like I said, I talk about Lassa fever,
Mhm.
I talk about the bovine TB and monkeypox and other different diseases that come from animals to human.
Okay.
So um, it, before a project comes up, there can be an assessment
Surely.
to identify the need for the project to address that issue.
Mhm.
So, like I said, it's a USAID funded project. They identify that um, we were at the level of pushing just human health, human health, human health. But for us to get better health outcomes, we must tackle the three interfaces: the environmental health, the animal health, and then the human health. So for you to have a good human health outcome, you must have a very good environment that is intact and healthy animals, because you interact with the animals in the environment. The human being and the animals interact in the environment. So until we can tackle the three of them from one angle, we're not going to achieve an optimal health outcomes.
Okay.
So it's about you know achieving health outcomes that cut across the three spectrum.
Okay.
Yeah.
The human, the environmental, and the animal health.
Yeah.
Okay, now let's hear from the MOA, the Ministry of Agriculture. Mr. Fangalo, what is the strategy in place to cover or to vaccinate all of the dogs and sheep and goats around the in the 6 counties that you're currently piloting in?
Yeah, thank you. So for us, I think our hope is not to have emergency vaccination every time. Like 10 days is not sufficient to cover
Yeah, sure.
dogs and animals, but that's the constraint when it comes to the resources that partners give. Uh, Thanks to the World Bank, as I said, the World Bank is also supporting us. So the need for one health line is becoming a global thing,
Mhm.
because we've been pushing for just human health, human health, human health. Want to build hospitals, want to build this, want to build that for just human health. That is the Ministry of Health. So now the dynamic is changing, that you cannot do everything with just one sector.
Okay.
You need to involve all three, because all the three sectors play a major role in disease transmission.
Mhm.
And once that occurs, what happens is that it leads to huge economic burden on the country. We know Ebola, why even COVID-19, we know when COVID started, the kind of issues that occurred. So our hope is, one, to be able to get the government of Liberia support when it comes to this, to see the need that animal health quite important as human health is.
Okay.
Yes, so as it stands, we don't have a budgetary allotment from the government to see that we should have this sector as one of the sectors that is very important to human health. So we're thinking beyond. So through the One Health platform that is supported by the World Bank with this project, we have drafted a lot of work plans, putting activities that we need to have a hard stakeholder meeting, where we want to meet the legislatures on the importance of vaccinating animals or taking animal health as one of the major components if we want to have a good public health. So that is on the way. And also WHO also saw the need, because there are gap analysis that have shown. We have the joint external evaluation that show those gaps. We also have the performance of veterinary services that also show those gaps. So it's just about the government taking those gaps and then turning into activities, and then now we can come up with other strategies. Because every year, every 2, 3, 4, 5 years, people come to evaluate those gaps that were identified. So the whole thing we are thinking on our true partners is that, yes, we agree you can have this short funding for 10 days is not sufficient, because animal vaccination is not like human vaccination. You got to go in the bushes, but there where the animals are, you have to go far, walk, no motorbike, nothing, because those are where the animals are. But can we really have a real plan for the government? Because the government has to own it. It's not partner, because 10 days, as I say, is nothing.
Yeah,
we need
sure.
a whole year-round vaccination, because the whole idea of vaccination is very new. People didn't know that animals need to be vaccinated. Even when you go in the interior, they ask, but why would it be? So we are looking at having a sustainable one, and then the higher thing is to have the buy-in of the national government, and then we can really know exactly where we are headed. But I think the issue about animal health, environment health, and the human health is something that we are really driving at, and we have World Bank that's bought into that idea. We have FAO that's also the partner to MOA. We have the World Organization for Animal Health that also responsible. We also have the tripartite. So the tripartite now has gone. We have 4 international organizations that are into this One Health. We have the United Nations Environment Agency that is now that just joined the tripartite. So now we have 4. We have the World Health Organization, we have WHO, and then we have the FAO. So globally, those 4 entities have decided to push this One Health because One Health is the way to go. So as I said, we are trying to engage the national stakeholders, the legislatures, the caucus on health and agriculture to be able to talk to them, do some presentations, because for me, if you give us the platform, we'll do some presentations to give you detail of what are the diseases, what are the other impacts when it comes to human and also the economic aspect, because some of us went to school because our parents and sold goats, sheep to be able to sell to UL. So now if the person has about 100 goats and sheep, and then this disease come in and kill everything, what happens? And then somebody who now goat is cost, let's say $150, and when the seller, the buyers get to know that there's an outbreak of the disease in this county, they go and take it as low as $10, So that's farmer have lost $140. So just do the multiplication. If the person had 10 and then sold this as $10 each, see what the person has lost. Because they don't want for them to lose everything. Because when the animal dies by itself, nothing you're gonna get.
Sure.
So it's better you sell it while it's still sick.
Yeah.
So the vaccination of that animal, it goes for the lifetime. So once you vaccinate the animal against the PPR, it's not the rabies you need to go for every year, it goes for lifetime. So we're encouraging people that we get a vaccines in country enough. And the support have been an issue. So it's the haphazard one. Partner come and say we have 10,000, let's go and vaccinate. We say okay, yes, we'll take it. But I think that is not the sure way to go. We really want to have a sustainable plan and have a routine site where people can take their animal at any time. And then we also want the farmers to get interest. So as I said, we'll be happy we can have some few minutes, maybe a week or a month at ELBC to come and take disease by disease and then tell people what are the signs and symptoms and what can they lead to when it comes to the outbreak in the human population. So I think this is a good platform, as I said, but we need a sustainable plan. That is the buy-in for the government, and that will be a need for us, the government, to have a budgetary allotment to MOA vet service, where we will have to have this as a routine service. Vaccine, we request for vaccine, they give it to free of charge. And what we're doing is all free of charge. A farmer cannot give a dime for anything. It's completely free of charge. The rabies vaccine is also completely free of charge as of now. So we are trying to create that awareness that people need to vaccinate animals for the betterment of the population.
We're hoping that you can get the sort of support that you really need to sustain this program. But initially you spoke about the tradition, especially where some of our people see it as a pleasure, eating dogs and all of that. Is it a risk? Is it a danger for one to eat the dog, especially when it has been vaccinated or
Yes.
not?
Yes, so no, once the dog is vaccinated, it doesn't do anything for someone, because that's what I mean. One of the issues is that okay, this man don't raising my dog to eat it. So you think when I vaccinate, I'll be able to eat it? We say yes, it's just a matter of the time it will be living. You should be able to vaccinate, because you can't tell when it will affect you. So we know that's a tradition. And you see animal diseases, even though it's the saliva that gives you the rabies. Normally it's the saliva, because if the dog bites you, it's the saliva that gives you the rabies. So the issue is, people say, I cook my animal well. We tell them how well it is cooked.
Okay.
Because you can't tell how well it's cooked. So, when it comes to communication, that's why breakthrough action is coming with that arm. We need to talk to people on how to prevent those things. Because when it comes to animal diseases, those who handle them are at higher risks than those who eat them.
Okay.
Yeah, because once you are playing with, and not just dog, but other animals diseases, the anthrax, the Lassa fever, and other Rift Valley fever, brucellosis, bovine TB. That's one of the things, because bovine TB is like a TB that is in cow or cattle. You see it even almost looking the same as human, dry. When they eat it, those we see the animals around, people eat them. So that's another disease that people get from eating contaminated cow or cattle, as we call. So there are a lot of diseases out there, but those who really handle them are at higher risk. So that there's also female. The female cook our chicken, and then once you get home, you just see it cooked and then eat it. But the processes they pass through, so now they get pricked with the bones. And we have what we call it highly pathogenic avian influenza that causes mass death of birds.
Okay.
We have something called Newcastle disease as well. We call chicken sickness. When the chickens turn, you'll just be sleeping at the end of the day, you just die. And people say, just take that thing and then put palm butter on it. And we did all of those before. But who knows whether those things we did before are now affecting us.
Yeah, sure.
So there are a lot of good things within the animal health that we need to give out. We need to be given a platform. And the major thing is for the government or the legislators to know exactly the importance of such a sector to the health of the population. Because if you don't have a healthy animal, you don't have a healthy environment, there's a risk that no matter which hospital you go to, you still come back, you still get sick, you still keep spending. And that's why we see people coming up with a lot of things. They have only diseases now. And one key thing I want to also bring from that sector is what we call the antimicrobial resistance.
Okay.
Because people use antibiotics on animals for growth promotion. If I want my animal, my pig, my goat, or what to be very big, I have to give them more antibiotics. Now, if you give the animals, because we are not aware, or people are not aware of that, and you give the animal those antibiotics or antimicrobials, and then they build resistance to it, we don't know the withdrawal period. So once a person do that, if let's say they give them the vaccine, the antibiotic last week, and then decide now tonsillitis is coming, the person is going to slaughter the animal and then put on market. So we are taking the raw antimicrobials within us. So once you eat it, at the end of the day, you start owning your own typhoid. Because if you take any antibiotics, it doesn't work.
Okay.
Because they are bill-resistant fungal. So animal is something that people really pump those things into because it's of growth promotion. With each chickens here that have been imported, but we don't know where they are coming from because people also need to give them, because I don't want to lose my animal because I have to give them antibiotics. Also the preventing, also the growth promoters. And so there are a lot of things that if we really focus on animal alone, we're going to have a safety product. So I think this platform is not enough
Yeah, sure.
to talk about, but I think those are key to talk because antimicrobial resistance also become a global issue. When other partners in the One Health platform is going towards, that's another pandemic that's gonna occur because we eat a lot of frozen foods. People that are now also focusing on the animal side to monitor whether the animal was given antibiotics or whether the withdrawal period has reached. But we just slaughter, and I'm so sorry that tonsillitis is coming. We're going to have a lot of animals being slaughtered. Whether the person,
So you gotta be careful when you are listening whether they didn't give, whether the person who slaughtered the animal didn't give the animal some antibiotic to make the animal grow big, and you see they slaughter now, you put in the palm butter or the cassava leaf and you eat it at the end of the day. But are you extending this campaign, Mr. Fangalo, from the Ministry of Agriculture to let's say where they are keeping and selling the goats, and that's a cow factory?
Yes.
It's going there too.
yes, thank you so much. So with the under administration of the Minister of Agriculture, Ms. Jenny Medekopo, I think that's been very instrumental. And also the Deputy Minister for Technical Services, Ms. Lina Andrews, she also been very good with that because that is the technical service that the vet service is located. So within the slaughterhouse at the Curious-Bird, we have men there that can inspect animal before they are killed and after they are killed.
Okay.
So we have that manpower. But is it sufficient? I'll say no. Because the major thing is we need a buy-in from the government, I would say, because if we even go there, like for example, the last time we had about 520 cows that came in for the celebration of the Ibrahim Day. So through the support of the Minister of Agriculture and the Deputy Minister and all ministers there, we ought to inspect those animals at the borders.
Okay.
Because we thought that they were coming from Sierra Leone, and Sierra Leone reported a case of anthrax. So I did that through her administration. We ought to inspect the animal through the surveillance purpose, and then the animal was slaughtered. And yet we haven't seen any issue coming out. Whether somebody showing signs or anything. So those are the things we want. So I think people our ministers and Ministry of Agriculture are getting to know, they are aware. So those are steps, but I think we need to go further. So if it's talking about spraying, yes, it's our hope to go across the 15 counties. Because from Enfield website or from the data they collect, we have hotspots that are having more dog bite cases. And we have Maryland, we have Grand Gita, those counties are there, but we are, as I said, we have a constraint. We have the vaccines in stock. But how do we move out to go and vaccinate? That's an issue. That's how we ought to get funding from Airfield, from World Bank, from Breakthrough Action to just cover 6 counties. And September 28th every year is a World Rabies Day.
Okay.
And the World Bank, through the reducing support, have a whole package to have a national a vaccination campaign. But we say it's not sufficient still. You cannot have this just on a day,
Surely.
or even because the time is coming, want to commence that you have to do that. So our hope is to have just this standing days so where we can go at any time, farmer can go at any time to be able to vaccinate. Because if you vaccinate a dog, let's say now this campaign, any dog that is born after this campaign is vulnerable till we have funding to vaccinate another time.
Okay.
That's not good public health. So there's a need for us to have, if the person dog is vaccinated, is born today, after 3 months, the person should know exactly where to take the dog to vaccinate, and then we'll give you a certificate. But we cannot wait for 1 year or for Rabies Day celebration or an emergency because somebody was bitten. And quickly, the main thing we are saying is that we shouldn't wait for human to start getting this condition before we put emphasis to it. And that's our been issue we've been facing. We know Ebola when it first started in Lofa. We added someone, and then when the human were dying and it's late. So the thing is, we need to see how we can really focus on the other two sectors that are not human related, prevent before any other thing can happen. So I think the mind need to change. So we have a plan. This is the first phase, and we get funding from donors. We'll still go into the other counties, but for vaccine, we have vaccines enough in stock. So those who want to afford for the dog to be vaccinated today, tomorrow, after the campaign, we can still provide our service. We'll just need them to be able to call us, tell their location. We'll make sure to go. But the major thing is about the mind that people want to do this.
You know, I learned this when I was at the Ministry of Health, and often I was always in conversation with the man who's responsible for immunization at Dolphus Clark. Okay, having a vaccine is just one thing. Like you just said, you have a lot in stock. But, keeping the potency of the vaccine is another thing. They're talking about the storage. Well, how is it like now?
Thank you. So as it stands, because of this power struggle, even at the Senior Prayer Lab, the United Nations Food Organization is the one storing this vaccine. And thanks to even at Dr. Clark you're talking about, because under the One Health platform, animal health, we don't have storage facility at the county levels.
Okay.
But through this One Health, right, we are storing the vaccines in the counties now at the EPR centers. They're the ones storing the vaccines because agriculture doesn't have the setup.
Okay.
So this One Health platform through the World Bank and other supports, we've realized that it's something that reduces burden. It's also very economical because if agriculture needed to have had all the storage facilities before the vaccinate, I don't think we'll get it soon.
Yeah, surely.
Because we're still trying to mold the minds of stakeholders and donors or other well-wishers to see how important animal health is. So at Dr. Clark, I've been very instrumental in providing those facilities. So for the potency, is good.
Okay.
We have, so even S packs when they are leaving, when you get to a clinic and the S packs is not, we can change it there as well through the One Health platform. That has never happened before. So I think we have an existing. So right now, everything is still at the headquarters of the UN through FAO support. Only we request and take them out, and then we take it in the counties and store it at the facilities of the ADA.
Okay, let me go to Mr. Khan before I can open the lines quickly. Breakthrough action. Mr. Khan, you heard your colleague from Agriculture Ministry.
Yeah.
And he continues to be more focused. Talking about the aspect of sustaining the campaign. He said the 10 days not sufficient, enough to really cover and protect our animals against rabies and all of that. It's breakthrough action thinking about seeing how you can maybe look again into your comfort to say, look, let us not only be concerned about the PR aspect, but let's go to also help the Ministry of Agriculture for sustenance. Are you seeking that direction?
Well, so breakthrough action work, like I said, is a social behavior change project. We are more into health communication. Yeah, so we support activities that come up from the One Health platform through the risk communication and community engagement arm. So once the One Health guys through the ministry are all the design programs that we can fit in, then we can come in with our support.
Okay.
So that's how we work. But we are more into health communication for health behavior change.
0776 540 987. That's the alternative line. 0776 540 987. That's the alternative line. The studio line 0880 514 096. Again, 0880-514-096. That's the number to call, and you are live. Let's take the first caller. Good morning. Oh, this caller is off. Let's take this other one. Good morning. Good morning. Okay, let's hear from you. Mhm. Many thanks. They'll respond to that. 0776-540-987, or better still, 0880-514-096. Let's take this call on the line. Good morning.
Good morning, Sarah.
Yes, good morning, sir.
Yeah, I'm Amos Matari calling from Disco Zero Lower Party, Wisconsin.
Okay.
Yeah, I want to know from your studio guest what are those that born one day old or 2 day old they are supposed to get virus. And I want to know how can they go near those dogs? Those dogs are very risky. How can they want the little dogs and are very risky?
Okay. Okay, they'll respond to that. They are taking notes. They'll respond to that. Rest assured. Good morning.
Good morning, Sobot, and good morning to the Constable de Liberia.
Good morning, sir.
My name is Abraham Political of Josetu, and I'm all from the most of the back of Avenue of this morning. Let me appreciate two distinct studio guests. Basically, no right information and right time bring hope to the public. I think the exercise is very more unique, and I hope and pray there will be more awareness to the situation because I think our animals too need and deserve good help. And I want to ask this question: will chicken and dog also be part of the exercise?
Okay. They are taking note. They'll respond. 0776-540-987. Good morning. Good morning. Let's hear from you, sir.
I want to commend him. Just get for the dedication and also for that make sure that people are part of the make sure that animals are back. But more often is what we look at again and really kind of for instance, one is really if it does like that or somebody, you will get it and that you know if you have any method that you can take what or any number of things.
Okay. Many thanks as well. Many thanks. Good morning.
Yes, good morning.
Yes, sir.
My name is James T. Bella Jr. calling from Puebla.
Okay.
Yes, I want to, extend my thanks and appreciation to our studio guest this morning. And that is a fine initiative to deal with the rabies cases. And my appeal to them is that this campaign, I want to be part of this campaign. So that is my number. If you call me or if it will be necessary that you can call me, then I will be part of the campaign.
Okay. Many thanks. He wants to be part of the campaign, you know. And so you said, this is his number. Let's take this call on the line. Good morning.
Yeah, good morning, Brasara.
Yes, good morning.
Yeah, this is Abu Sherry.
Yes, sir, Mr. Sherry.
I'm calling from Children. Yeah, that's
What happened in the garage?
Yeah.
Okay, so you're trying to knock the old car now? Okay, that's good. Let's hear from you quickly.
All the animals, that is my wife, get dog, cat, chicken, dog. So that's 4 animals. So my wife is if all of them need to be vaccinated.
Okay. Okay. Yes, they will respond. They are taking notes. Rest assured. Let's take this call on the line. Good morning. Yes, good morning, sir. Oh, you have to change your location, please. We can't continue with you, or you have to change your location. Your line is sounding distorting, please. Okay, so let's take another call on the line. It seems we can. Good morning.
Good morning. How are you?
I'm okay, Mama. How you doing?
Yeah, I'm okay.
Let's hear from you.
Yeah, some of us will have dog, and sometimes we try to put it in car, and people can stop, but not to put it in car. So how they can reach to us for the vaccine?
Okay, that's good. That's good. The poor want to bring that dog. Good morning. Good morning. Please lower the volume. Lower the volume of your radio.
Yeah, good morning, sir.
Lower the volume of your radio.
Yeah, I'm not near the video.
Okay, go ahead now. Go ahead.
Okay, I'm Colonel Johnson. I'm calling from Vancouver.
Okay.
Yeah, okay. All what you're saying is right, and we appreciate all those in the studio guests. But the process of when these things happen and the dogs are, or I mean the animals are not vaccinated, then people eat them or want to eat them. The process of preparation. What I want to know is the process of preparation. Can they tell us this?
Okay. I think they understand what you just said. Good morning. Good morning. Oh, this person is not ready yet. He's talking something else. 0776 540 987. That's the alternative line. Or better still, 0880 514 096. You call those numbers. You are live. Let's take this call on the line. Good morning.
Good morning.
Good morning, sir.
My name is Aaron Kowi. I come from Banga.
Let's hear from you, Aaron.
I want to ask the TV guest, is there this vaccination is only for the dog or it is for other animals? And it is they are doing the vaccine. Is it free or is it being paid for?
Okay, they will respond to that. Let me take this last caller. Good morning.
Yeah, good morning, Mr. George.
Good morning, sir.
Yeah, good morning to the studio guest there. I'm Reverend Kinsey first now from Sesto Riverside.
Okay.
And I have a question, and apart from the question, I could make one recommendation, please.
Go right ahead.
All right. My question is, I understood that the people selected about 6 counties that they will go, especially for the animal. And I am in the business of animal rearing. So I want to know as to whether they will come to the southeastern area, especially for Basa, Riverside, Sano, and other counties that are not being used, apart from Nimba and so. That is the question. And then the recommendation is that since in fact they are doing the awareness, let the awareness also affect the southeastern, because you know our people, they are always in the usual habit of denial and this traditional mindset. So since they are using this means of engaging people socially, it's more important to use the radio stations in the rural counties and the binoculars, so as to help those people know the important. Then, of course, when it comes with the project of undertaking the vaccine, people who have no doubt, people
Okay.
who have, and a lot of things.
Many thanks, many thanks, many thanks. I think you make a point already. Let's go back to our studio guests to respond, and then we'll take leave of them.
Okay, so I'll begin. So the first thing, I'm very impressed this morning with the number of calls coming in. I think this is the first time we've been appearing on other talk shows. We at times only 1 or 2 person can ask, us call on the show. But I think it shows that they are getting interest in the entire animal issues. So to begin with, if you have a dog, you need to have a responsible dog. You should be a responsible dog owner, that the dog will know you. So we cannot come and vaccinate and be the one to hold your dogs. No.
Okay.
You as an owner need to hold your dog because the dog know you better than us. Because we are even afraid to even be bitten by the dog as well. Though we have mouth guards that we can use, but still, as I said, some dogs are very, very dangerous when it comes to stranger moving to them. So the owner should know how to hold the dog. And secondly, for vaccination of chicken, those vaccines are available. We just need the public demand, because and then that can be delivered. So for some ECS, I agree. But what we can do now, since we have the vaccines in stock, we need people to mobilize those animals. If you have a group, just call us. I'll give my number. It's 07759 0035. 077759035, or come to the Ministry of Agriculture and then just pour in for the number of vaccines you need. We'll send manpower to go and vaccinate, and the vaccination is absolutely free of charge. You don't have to give anything. If somebody is coming to your house to vaccinate and asking for anything, just call us. So the door is open at the Ministry of Agriculture. Come and make a request. Call us that, okay, we'll have 10 dogs, we'll have 20 dogs, we'll have this dog in the community. We'll send men there to vaccinate. So once again, I'm very interested in this, and I'm also really happy that many people call in to really get information. So we hope to have more of this on the talk show or other platforms to be able to give those things.
This is the biggest platform in the country.
Yeah.
So you come here, you have lots of people listening to you.
So,
Okay, yeah, let's
so
hear from you.
somebody asked about wild animals. So right now we only vaccinating domestic animals, because wild animals are animals that we can get to in the forest now.
So easily. Yeah.
So those that we have in our homes that are close to us that we interact with, those are the ones we target. So the vaccine is not restricted to only dog, but we also vaccinate cat. So because studies have proven that cat can also be a carrier of rabies.
Okay.
So we also vaccinate cat and
Somebody asked about chicken. Chicken are included, right?
chicken for now no, but like Eddie said, there are vaccines for chicken. So it depends on if you have the need for it.
Okay.
You can get to the Ministry of Agriculture, and then they can provide you with that. So yeah, so that's
Yes, okay.
So
Yes,
sorry.
Father.
So for the issue of the wild animal, we don't encourage that, because we don't want to go in contention with FDA.
Okay.
So if you are keeping monkeys, you are keeping the other animals with you, it is forbidden under the law.
Okay.
Yes. So we don't want to. So you don't keep those animals. They are wild animals, and they are the one that even having the interfaces with domestic animal equipment. So we can vaccinate cat, we can vaccinate dogs, and even the squirrel, as you said. In Lofa, people were bitten by squirrel and they died instantly. And then we have also detected rabies in raccoon at the lab. So currently we have over 40 confirmed cases of rabies in dogs, and more than 3 in cats, including raccoons as well. So we need to be careful, because even the hunting dogs are the one that even risk it, because they go there, fight with those animals that already have the rabies within there, and at the end of the day they come home with that. So that's just what I say. So keeping those domestic animals or the wild animal with you is forbidden on the law. If FDA sees you, you're going to go to jail, or they're going to fine you. So we don't encourage people bringing their monkeys or that to fight. We can vaccinate them, but I think it's against.
Many thanks, Mr. Eddie Miawe Vangalo. He's the director of epidemiology at the MOEA, that's the Ministry of Agriculture. We really want to appreciate you for taking time of